And good afternoon, folks. This is our shed of the Shed Group. And, folks, we are a day beyond the ending of the annual enrollment period. Of course, during that period, October 15th to December the 7th, you were allowed to switch plans, switch from one, let's say, Medicare Advantage plan to another Advantage plan, go back to a Medicare supplement, pick up a Part D plan, you name it. The gambit was open to you to kind of make the changes that you needed to make for the upcoming year 2026, right? So, look, a lot of conversations during this period, okay, with people. A lot of people were concerned because in certain cases, some carriers were dropping their PPO plan, right? Some carriers were leaving counties, right? Right. So there was a lot of, I would say, turmoil in this season. However, if you happen to be part of our block of business, in other words, if you're in Central Indiana and you happen to be with us, you're probably in United Healthcare's PPO. So you have a carrier who didn't drop their PPO. All right. They made some other modifications, but they didn't drop their PPO. A lot of other carriers did. That's important to note. So I wanted to take a little bit of time today and tell you about the big differences that you need to be aware of for next year when it comes to the PPO and the HMO. I'm going to start with the PPO first, then we'll work our way to the changes in the HMO because that's going to require a little bit more conversation. So, first and foremost, when you look at United Healthcare's PPO, and I don't know if I've said this already or not, but if you're in Central Indiana and you're with us, when it comes to Medicare Advantage, we only represent United Healthcare when it comes to Medicare Advantage. We sell a lot of other supplements, but when it comes to Medicare Advantage products, we're going to recommend United Healthcare. Why do we say that? They're the biggest, right? They're stable, right? There's value in their out-of-pocket max being the lowest in the industry. It makes sense. Okay. So if you're with us, you're probably in a very stable environment if it's Medicare Advantage. Now, when it comes to the PPO plan, two pieces of information you need to be aware of. Your premium is going down, right? $32 next year. It's $39 this year. The out-of-pocket max went up $100, right? So $3,800 this year, 2025, up to $3,900 for next year. Not that big of a deal. Again, the fastest way to your out-of-pocket max will be through the inpatient hospitalization and skilled nursing stay. So if you're in a hospital for 5 days, you probably spent well over $2,100, right? And if you're in a skilled nursing days on average for a period of 30 days, guess what? Then you've probably spent another $2,000 in this plan. You don't pay for day 1 through 20, but you will pay $218 for day 21 through, let's say 30, right? That's another $2,000. So all in all, you hit your out-of-pocket max in your PPO plan. The PPO plan doesn't require a referral to see a specialist. That's going to be key moving forward. Okay. The PPO, again, a very stable product. A lot of carriers gotten rid of their PPO plan. United Healthcare didn't. That says something. I'm not quite certain exactly what that says. We'll see what that means over the next couple of years. Here's what I can tell you just anecdotally. The reason why a number of carriers got out of their PPO plan is because it cost a lot of money in order to operate. United Healthcare kept theirs in place. Now, we'll see. Will they have it in place for 2027? We'll see. And also remember, when it comes to this administration, they outlaid a 5% increase for Medicare Advantage plans over the next few years. They're in office for about 4 years. Hopefully, right? But anyway, the previous administration capped Medicare Advantage growth to 2.5%. So there's fewer dollars, really, from 2023 to about 26, 27. And then 27, 28, going forward, we'll be back at that 5% clip. So it's going to be lean again for 2026, probably even 2027. But if you're in a PPO and you're with United Healthcare, I think you're in a very stable environment. Okay, so you're in a good spot. Now, if you happen to have the HMO plan, pay close attention. Okay, reason is you don't have a premium, right? Your out-of-pocket max is $3,900. All of that sounds just like the PPO product outside the premium, right? $3,900 for both plans. You don't pay anything to see your primary care doctor, but this is key when you look at a specialist. $40 copay to see a specialist, but it does require a referral. Okay. Got to have a referral next year. I've been doing this for 20 years. The fact that United Healthcare did not require a referral was one of the key selling points for a number of years. Other carriers who have HMOs always required referrals. Now, some of them went away with it when they were getting more money from the federal government, but it came back, right? And for United Healthcare, next year, there will be a referral needed in order to see your specialist. Talking with management, they said that we're going to have about 2 quarters to get this firmly put in place with your primary care doctor, making sure the referrals are with your specialist, right? Why do we want that? If you don't have a referral to see your specialist, you could be on the hook for the entire cost. So I'm going to spend time with those individuals in our block of business who are in the HMO. And what can I tell you? Not many of you, right? But we are going to reach out to you at the beginning of the year because we want to make sure those referrals in place. That's the last thing we want is an unexpected cost or unexpected spending because we didn't have a referral in place. Okay. So otherwise, when you look at both plans, right, when you look at the HMO and the PPO plan, here's what I will also tell you. OTC, for most of the United Healthcare plans, you were either getting like $50 or $70. Last year it was $40 or $50, or this year $40 or $50, right? That goes away next year. Now, for some people, they're like, well, other carriers have it. Well, that's true, but other carriers don't have a PPO plan, right? And there may be some smaller carriers that you've run across over the AEP. They have OTC, but they also have higher out-of-pockets, okay? And in certain cases, they don't have a plan in every contracted county. So, differentiating factors. All right, so keep those things in mind. I mean, the HMO and the PPO, if you're not sure which do you have, take a look at your card, right? Underneath your plan member ID, you're going to see the plan name. And let's say it says UHCIN 12, and then it will say HMO POS, or it will say 002 PPO or 007 PPO. I'm speaking again, those people in Central Indiana. Okay. So be aware of what plan design you have. And again, we will be reaching out to you at the beginning of the year to make sure that you do have those referrals in place. Very important. Now, look, if you're in a Medicare Advantage plan, I say this a lot. About 40% of our block of business, well, they're listening to us. Okay. The other 60%, you need to really think about this because your spending is different than the spending seen by individuals who aged into Medicare, let's say like the early 2000s. Okay. We're seeing more denials and more prior authorizations that create denials. All right. So let's say you needed a prior authorization for an MRI. Okay. And it was denied. If it's denied, it's probably denied because of a coding issue. That's the overwhelming reason, right? But in certain cases, maybe there's more detail that's needed in order to get that scan you're looking for. Okay. But when it comes to the denial for skilled nursing services, we're seeing that a lot. So if you happen to have a Medicare Advantage plan, you need a hospital indemnity plan. You need that hospital indemnity plan because if you are denied skilled nursing, you can pay for that skilled nursing through your hospital indemnity. So not only does it provide you money for the inpatient hospital stay, but it will provide you income or money for the skilled nursing stay as well. Keep that in mind. That is going to become more prevalent. Why do I say that? Skilled nursing is the front line to long-term care. A lot of the problems that people have, and the reason why plans will ask people to leave early is because in most cases, the issue that's happening to the person has more to do with the ADLs of long-term care as opposed to healthcare services offered by Medicare. Now, in certain cases, if you have a Medicare supplement, you can get around that a little bit because Medicare supplement plans don't really look. And Medicare doesn't, Medicare does an audit of skilled nursing facilities, but they only audit 5% every 60 days or whatever the case may be, right? So highly unlikely an issue on the Medicare supplement side, but more of an issue on the Medicare Advantage side. Get yourself a hospital indemnity. If you want to get a quote, get with us. We'll get you a quote. If you're getting this before age 70, there is no underwriting. Okay, keep that in mind. It's just age based, and that's a good thing. Okay, underwriting gets a little bit more difficult after age 70. If you are at age 70, yes, we will take a look at the prescription drugs that you take. And yes, there are questions that we need to answer when it comes to underwriting. Hopefully, we can answer no to all those questions. But anybody who has a Medicare Advantage plan, you need a hospital indemnity plan. There are some other bonus benefits to having it. I won't get into that today. All right. Now, for those individuals who have Medicare supplements, here's what I'll tell you. You're not out of the woods either. Okay. Because premiums will continue to go up 15% or better. All right. And there are some classic reasons why. We have an alarming number of people who are turning 80 and over. Those individuals, when it comes to care, they're getting care more on the Part A side, the most expensive side of the Medicare house, right? On top of the people who are aging into 80, these boomers, there's already the silent generation. Still, there's like 28 million individuals who are in the silent generation who predominantly have Medicare supplements. Okay. They're utilizing more care, which means premiums will continue to go higher. All right. So if you have a Medicare supplement plan, just be aware of that. Also be aware that, people traditionally, we move from plan F, right, to plan G. And a lot of people who moved to plan G, it was cheaper, but those people also were utilizing more care. So people who are in plan G are now migrating to plan N. And if you look at the cost and run rates for plan N, it's starting to trend up too. Okay. So in order to get ahead of all of this, if you happen to be the person that favors a Medicare supplement and you're aging in, you're turning 65, you're not happy or think that you're not going to be happy with a Medicare Advantage plan, get yourself a high deductible plan G. Okay. It's stable. Most of the rate of increases are around 2%. You can handle that. Okay. So if you have any questions about any of that, let us know. I would also tell you that if you're going to get that plan G high deductible, get yourself a hospital indemnity plan. Okay, I'm going to repeat that again. Why do I say that for those individuals who have Medicare supplements? Well, you're paying a little bit more in cost, right? If you have a high deductible plan G, maybe your out of pocket is around $3,000. If you have a hospital indemnity, that will pay the bills. Okay. It will also provide you with some other bonus benefits, of which, again, I will not talk about on this particular video. But if you want to know more about it, get with us and find out. Again, if you're 65 to 70, no underwriting required for a hospital indemnity. So whether you're in a supplement or whether you're in an Advantage plan, you need a hospital indemnity. Okay. Those are going to become more popular. Okay, folks, a final note. Look, if you retired and want to make an additional maybe $2,000 to maybe $10,000 a month, we're hiring, and we're hiring for final expense life insurance agents. So we'll give you the training, tell you everything that you need to know, right? Get you prepared to make money in this space. I know a lot of people are retiring today and don't feel comfortable about their income. We're here to help there too. So look, folks, all done. If you had a Medicare supplement or Medicare Advantage, we're here to help you. Reach out to us. Best number, whether you're looking for employment or you're looking for assistance with regard to your planning, 765-252-1533 or our 800 number, 1-888-969-7822. We work all over the state of Indiana, Illinois, Ohio, Nevada, Texas, Arizona, California, Maryland, Virginia, Florida. We're not everywhere, but, if you call us, we can probably assist you wherever you may be. So that being said, folks, hey, enjoy the season, right? It's Christmas time. Enjoy your Christmas, enjoy your family, enjoy the New Year's. And guess what? We'll see you in 2026.